I need to talk with Dr. Ranjeet, alas, only on the telephone. Doctor, what can you tell us about what happened to Christian Eriksen yesterday?
Hi, George. Sorry we're having some difficulties, but it's good to be with you.
Thank you.
It's not totally unusual for young, extremely fit athletes to have cardiac problems. And in fact, most of them, especially in the Football Association, would be routinely screened for these. Clearly, it's different from people. We think of elderly people as getting coronary artery disease leading to heart attacks, and that's caused by high blood pressure, high cholesterol, diabetes, age, and certain other genetic factors. But this is a different disease. So in the young, it tends to be either a problem with the conducting system of the heart, so they get an arrhythmia, a sudden change in their rhythm, where they get a very fast or a very slow heartbeat and leads to a loss of cardiac output and blood pressure. Or the most common thing is some structural abnormality of the heart. Obviously, we're talking about incredibly fit individuals. It's kind of well known, for example, Christie, a British great sprinter, now retired, used to have a resting heart rate of about 30 beats per minute, where I have one of 55, average of 72. And so it means that the heart is incredibly strong and incredibly efficient. And all of that training leads to an actual increase in the bulk of the muscle of the heart and a slight change in its structure, which means that sometimes with extreme stress, it has difficulty, because of its own muscular bulk, pumping blood through it. That's a really strange idea. It's called HOCM, or hypertrophic obstructive cardiac myopathy. And of course, we'll conditions as well, but those are the most common. And you know, without wanting to be prurient or intrude upon his privacy, these are the most common problems that could lead to a heart attack in someone so obviously young and generally fit. It's not common. It is routinely screened for, and clearly, obviously, whatever the cause, we wish him the best, and we're very happy that he was resuscitated at least and has gone to get medical care.
Yes, I was going to come on to that, and of course, say all of us about his speedy and full recovery. But it's unlikely he'll recover to be a frontline international level athlete again, or is it? Can you so recover from a cardiac arrest to still continue as an athlete?
Yeah, it's possible, George, but clearly having so there are two things. One, is there any lasting damage to the heart? And we don't know that. It'll be early to say. And we hope there isn't lasting damage to the heart. But even then, he would want to ascertain the exact cause and see whether that cause is treatable. If it was an arrhythmia, if it was an irregular heartbeat caused by an abnormality of the conduction system of the heart, sometimes that can be treated. There are conditions like Wolff-Parkinson-White, where there's an abnormal conduction pathway that can be treated or ablated, and then actually you're at low risk of further events. If it does turn out to be this hypertrophic obstructive cardiomyopathy, then it's less likely he'll come back, even in the absence of severe damage to the heart, simply because there would be an increased risk of further events. So you're right, the prognosis in terms of his sporting career is great, even as we hope he will survive this event, George.
And now the doctors said that they felt that they had lost him there on the park, but the doctors and the other physios and so on seem to have done a remarkable job, because by the time he was being carried off, on the pictures, which perhaps should never have been taken, you could see that he was by then kind of trying to sit up, and therefore my son's fears that he had died were unfounded. What would the doctors have done there on the park?
So essentially, George, they will be using standard cardiopulmonary resuscitation, advanced life support techniques to give cardiac massage, the kind of repetitive pumping of the chest, which is actually to do the heart's job for it and restart the circulation, and also to provide oxygen into the lungs. And that will be the absolute mainstay. Apart from that, there are drugs to administer, and it's possible to, depending on the rhythm of the heart, to use electrical shock treatment also to try and restart the heart. But clearly, they were able to do so, and the quicker they're able to do so, the better the better the outcome for the patient. And it did actually seem that they, as you say, were able to get a return of spontaneous circulation actually relatively quickly, and that all bode very well for Christian Eriksen.